This Good to Go segment is sponsored by Corewell Health.
Corewell Health is working hard to make healthcare more simple and affordable for patients while providing the most exceptional care for all. November is Lung Cancer Awareness Month, and chances are you know someone who's fought a cancer battle at one point in their lifetime. Dr. Glenn Van Otteren is Division Chief for Pulmonology at Corewell Health, here to share some helpful information about lung cancer. And welcome, Doctor. Good to have you here.
Thanks for having me.
Yeah, how common is lung cancer?
So it unfortunately is very common. If you look at both men and women, it's the second most common cancer type. And then more importantly, it leads in terms of cause of death. So very common, second most common, second behind breast cancer in women and prostate cancer in men. But when you talk about those types of cancers that lead to death, it leads the fatality rate in both men and women.
Yikes. So how have treatment and outcomes changed over the years that you've seen?
Yes. So the outlook for lung cancer isn't great, but what is encouraging is that it clearly has improved, and the statistics in the last 5 years in particular really bear that out. We're seeing better 5-year survivals, how we measure it. And I think that's from a number of ways. We have better diagnostic tools than ever before, and treatments have improved as well. So better tolerated chemotherapy, but the one thing that stands out is now you've heard of the term immunotherapy, where it's not standard chemotherapy, it's much better tolerated. And what we are able to do is identify certain biomarkers that the cancers express. And we've over time developed specific drugs, more and more drugs that use the body's own defense mechanisms to teach the body to identify the cancer and treat it by itself. Cancers have this way of hiding from our immune system, and these special immunotherapy drugs are able to make that cancer be visible, so it can stop hiding, so that we can overcome it ourselves.
What are some of the causes of lung cancer, and
Sure.
Can it be avoided? I mean, we all hear about the smoking thing, right?
Yep. So I have to mention it again. About 85 to 90% of all cancers, tobacco exposure is involved in that. Vast majority of those that are personal users of tobacco, probably a small percentage is from secondhand smoke, passive exposure, but it clearly accounts for the preponderance of cases. That said, air pollution plays a role. Radon exposure plays a role as a modifiable factor. Some genetic factors are involved. So there are a variety of factors, but clearly don't smoke. If you do smoke, try to make efforts to stop. And if you aren't smoking, don't ever start, because that's a wicked habit and very difficult to stop.
Yeah. What does diagnosis and treatment look like?
Yep. So I'd like to stop a little bit and say, really, before we get to diagnosis, the most effective thing is screening these days. So many years ago, through a variety of research trials, we identified that the use of a low-dose CAT scan was very, very valuable in identifying cancers early. And we know that the success in treating cancer is dependent on where we find it in its life cycle. The earlier we identify the cancer, the statistics on survival improve dramatically. So with screening, now with a low-dose CAT scan, we're able to identify cancers earlier, and that has greater impact on our overall treatment. So if you smoke more than 20 pack years, so 1 pack a day for 20 years or 2 packs a day for 10 years, you're in the ages between 50 and 80 years of age, and you've smoked within the last 15 years, you are a candidate to have a low-dose CAT scan. And with that, we can identify those early cancers, so we can offer better therapy, namely surgery, for example.
Yeah. And the more precision in terms of diagnosis and treatment and catching it early, is it impacting outcomes?
Yes, it most definitely is. So we're able to diagnose cancers as smaller in size with robotic bronchoscopic techniques. And then with surgery, we're using more and more robotic surgery, so we can do surgery for smaller lesions with less morbidity. The days of being in the hospital for weeks after surgery are gone. Now you can leave after a few days. But it's encouraging. We're making progress, and we hope that we continue to make progress.
Folks who want to learn more can visit spectrumhealth.org and search lung. You will find it there. Dr. Van Aderen, thank you.
Thank you.